Welcome. I'm Dr. Penny Stern, Chief of Preventive and Lifestyle Medicine at Northwell Health's Katz Institute for Women's Health. With me today are two of our experts, Dr. Deb McElligott, who is a doctor of nursing practice and a longtime cardiac NP, as well as a clinical lead at Northwell's Center for Wellness and Integrative Medicine, and Ms. Ashley Baumohl, MPH, RD, CDN, an expert registered dietitian at the Katz Institute, specializing in medical nutrition therapy. Together, we'll be speaking about several important topics relating to lifestyle and well-being. Now, lifestyle behaviors have long been recognized as central contributors to health and well-being. Lifestyle medicine is the specialty dedicated to providing everyone with evidence-based strategies to prevent, treat, and often reverse non-communicable chronic disease. The 6 pillars of lifestyle medicine are a whole food, plant-predominant eating pattern, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. We'll be focusing on 3 of these pillars: nutrition, stress management, and sleep, as we look at what you can do to promote lifelong health. I'd like to start with you, Ashley, and ask you, what role does nutrition play in lifestyle habits?
Yeah, so nutrition is key in both the role of prevention and treatment. So when we talk about lifestyle medicine, we're essentially placing a large focus on our health in a very proactive way. Nutrition plays a key role in lifestyle habits that essentially can affect every chronic disease. So there's strong evidence for the role nutrition plays in cardiovascular disease, in diabetes, obesity, cancer, even autoimmune and mental health conditions. And so lifestyle medicine is very unique in that it places a focus on adopting and sustaining, keyword sustaining, healthy behaviors. And the research has really led us towards a plant-based diet approach, meaning that a diet that is rich in fruits, vegetables, beans, legumes, whole grains, nuts, and seeds. And this dietary pattern has been shown to lower inflammation, reduce risk for these various disease states. And so it's very fitting for nutrition to become part of both the prevention and the treatment plan. When we talk about picking up these habits that work for our lifestyle, oftentimes I get asked, is there an ideal eating pattern people should be following? And so in short, no, because eating pattern can mean a lot of things. It can be related to the types of foods we eat, the schedule we eat them at, the volume of our meals, are we eating larger meals or snacking more, or the consistency in which we do all these things. And so the right answer to this is whatever will keep us consistent in having a very satisfying and balanced diet. And so there's been a lot of research on this with macronutrients and the right distribution of them for each person. And really what we see is, regardless of what that distribution is, it really requires being in a sustainable calorie deficit if we're looking at weight management, or just a sustainable pattern that works specifically for the person.
So you mentioned balanced diet. What does it mean to have a balanced diet?
Yeah, so when we look at balanced diet, really what this means is we're giving our body the nutrients it needs to function properly. And so without the right nutrition, our body can become more prone to diseases, infection, fatigue, poor performance throughout the day, which could relate to productivity at work. It could relate to our exercise, our ability to move our body throughout the day. And so we just want to really make sure we're consuming foods from all of the main food groups. And this will include a variety of vitamins and minerals, antioxidants, getting enough carbohydrates, proteins and fats. And so this is the starting point, having this balanced diet, right? But I have to acknowledge, as a practitioner, I'm working with a lot of patients focusing on balanced diet, that it can feel very overwhelming, right? So, it's just the thought, okay, I know I need a protein and a vegetable and a healthy fat and whole grains, but to limit saturated fat and sodium and refined carbs, right? It's actually much more overwhelming. And so then the next thought is, how do I turn this into a meal and ensure I have the right combination of foods in my pantry and fridge? And so I think it's really important for us as practitioners to acknowledge how overwhelming that can be, because we have this like simplified my plate that we use as a visual, but really being able to apply that in our day-to-day in a way that makes sense for our lifestyle is where it can get a little tricky. So my recommendation is to always start with 1 to 2 staple meals, having, maybe like one whole grain that you make in bulk for the week, and really building from there.
Actually, let me ask you something. What makes nutrition so dynamic as it relates to metabolic health?
Yes, that's a good question. I'm sure a lot of people think, why is my dietitian telling me to sleep more? Why are they telling me to try and manage my stress? Aren't they just supposed to be talking about food? When we think about metabolic health, which involves sleep, managing stress, hormone balances, moving our body, it all plays a role on our nutrition. So there's this huge interplay with all of these dynamics to metabolic health. So, adequate sleep, getting into this restorative sleep phase, this can really impact our hormone levels, our energy, how we crave food throughout the day, the following day, right? So if we're tired, our body's going to want some fast acting forms of energy, right? So we're more likely to crave refined carbs and sugar because that metabolizes a lot quicker. If we're stressed, having higher cortisol levels, that can be associated with weight gain. It can also, there's a lot of research showing that it can increase visceral fat, which is the fat around the organs, moving our body. So moving our body in ways that feels good to us. So exercise doesn't always mean pushing us past this point of physical exertion, right? Going on walks has been proven to aid in digestion. Doing yoga is shown to improve balance and the control we have within our body and the decisions we make throughout the day. Cardio activity like running or biking can improve our lean body mass, which has a big effect on what our resting energy expenditure is. So how much energy we're burning throughout the day just at rest. And so when we start to resent exercise, we do it less. It becomes more of a chore, right? So knowing we get benefits out of all these different forms of movement, we can start to think about what do we want to prioritize, because consistency is so key.
You brought up so many excellent points there. I know that things are often changing in terms of dietary guidelines and guidance. What trends are we seeing now? What, in your, from your perspective, what are we seeing now?
Yeah, they're always changing, right? Just based on evolving research, feedback from consumers, just general input from the public. They're always trying to update the guidelines in, what makes most sense and what can be most applicable. So most recently, there's been a bigger trend towards focusing on overall dietary patterns versus just specific nutrients. There's been a bigger trend in associating nutrition with certain disease states. And then there's just been this evolution of how do we visualize what we need on our plate, right? So I'm sure we all remember back in the day, the food pyramid. And these visuals date all the way back to like earlier 1900s, and they've progressed since then. So, when we talk about now that we have the My Plate, the whole purpose of that is really to be able to look at our plate and see if we have foods from all the food groups. So, the whole idea that half our plate is fruits and vegetables, a quarter of it's whole grains, a quarter of it's lean proteins. That is the basis of where we want to start with, just looking at it and seeing if we can even just, start off with having 1 or 2 of those items. Maybe we can add another one of those from the categories. And it just makes it all a little bit more tangible looking at something that is a plate, because then we can apply it. A few years ago, the FDA also required changes to their nutrition facts panel. So they were updating, and this was probably the first major update that they've had in over 20 years. So the changes were intended to make it easier for us, the consumers, to make more informed decisions, especially around foods that are prepackaged. And so It's updated things like the portion sizes, the serving sizes to be more realistic to what the general population is eating. Just one off the top of my head is ice cream. The portion size used to be a half a cup. They changed it to 2/3 because no one's eating half a cup of ice cream. They changed how they have to label the portion sizes, right? So if we have a bag of chips and a serving, it has 1.5 servings, they then have to put what the serving is for just a portion, and then, or what the nutrition is for just a portion, and then what the nutrition is for if they were to eat that whole bag. So it's meant to be more reasonable to us, the consumers, less surprises. They're having to put things like added sugar. They're having to update the percent daily values based on changes of what they think we need in our day-to-day. And those are probably the biggest trends that we've been seeing in terms of dietary guidelines.
Yeah, the change in labels has been fascinating over time. Those of us who are old enough to remember what used to not be on labels compared to now, it's really extraordinary. So what do you say when people ask you about fad diets? I mean, when I was young, there was the grapefruit diet, and then all the permutations thereof. Like, what do you say when people ask you, "Oh, have you heard about the fill in the blank diet?" What do you say?
Unfortunately, I think we've been doing a lot better in terms of marketing with just this whole foods approach, but fad diets are something that will never go away, right? There's always going to be marketing out there that will be some sort of quick fix. Get rid of your love handles or reduce your belly fat or like lose 10 pounds in 1 week, right? None of that's realistic. And none of these fad diets were developed by dietitians, right? So it's no one that's actually specialized in nutrition. The first thing I always ask people is why they're interested in the first place, right? What's their motive behind it? What do they want to get out of doing that fad diet?
They want to get skinny.
Yeah. And anytime, whenever I have an initial appointment with a patient, I always ask them if they've ever been recommended a diet, if they've ever done a structured meal plan before, and if so, what did they like about it? And then also, what didn't they like about it? Because that can tell a lot about a person with what they're trying to get out of being. More often than not, people just like the structure. They like having numbers to aim for. They like knowing what is they should be having and what they shouldn't be having. And so I think that that's what all people are really looking for. So when we have these diets that are like, only eat grapefruit or have cabbage soup or, don't have any carbs, it gives them this structure that's very helpful from a mental standpoint. What a lot of them find difficult is the sustainability. So I think that it really helps being able to identify there are helpful aspects of these diets. And, every year the US News does this popular diets ranking. And they, the top ones always end up being the ones that are the most varied, right? So usually, so we have Mediterranean dietary patterns, DASH diet, which stands for dietary approaches to stop hypertension. Weight Watchers even gets a lot of attention in terms of a balanced approach. So we can see popular diets from that perspective, and the ones that are actually successful are the ones that are more varied, have more of a balance, because those are the ones that are most sustainable. And so even just asking a person what their intention is behind doing a fad diet can really help open up the discussion for what works best for their lifestyle.
So on the whole, recommending fad diets is a no-no. No matter how good they seem on paper, right?
Exactly. It's, because once again, we have to think, is it sustainable? Some people are like, I just need to lose 10 pounds for a wedding I have coming up, or, or it's just I'm going to be in a bathing suit for the next couple of weeks. That's a lot of thought process, but really is their goal. And then, I could talk a lot more about short-term and long-term goals, but I think that really understanding the person intention and being able to navigate that based on what their needs are can be very helpful. Yeah,
I guess can't stay on cabbage diet forever. So from you and we're both public health people. From a public health standpoint, how can we as healthcare professionals and for those who make policy, how can we do better?
Yes. It's such a it opens up a whole bucket of topics, right? I think when we just talk about food industry in general, right, there is this overproduction, overconsumption of hyper palatable foods. Things that really, I talk about this a lot in my appetite awareness therapy classes, is just this desire to eat these hyper palatable foods because that's what we get used to, right? It makes healthy foods, it makes fruits even seem more bland, right? So having this ultra processed food that creates hyper palatable food just from the food industry has really created this skew in what we perceive as tasting good, right? Or what's nourishing our body. There is also just this idea of, so much of the language that we put out there with good food versus bad food versus this all or nothing mentality around eating. So I think from a public health standpoint, how we talk about food and the verbiage we use around food is so important. And then from a population standpoint, I mean, there's been this rapid increase in just urbanization, right? So a lot more people are moving from rural areas to more city settings. And so with that, there can be this big gap in socioeconomic statuses and access to food and access to healthcare, consistent access to healthcare, and the impact doesn't just have on that person, but their families and their community, feeling safe in their communities to even do physical activity, or having grocery stores nearby that don't just offer packaged food. And so as public health professionals and as, policymakers in that field, I think it's really important to figure out ways where we can get local farmers, whether it's subsidizing the food they bring in, or whether it's just allowing for more resources and clinics that are well staffed, not overworked, and being able to provide this consistently to people, because there's such a ripple effect when it comes to someone's health, right? They don't have access, might develop some health conditions, then their healthcare costs go up, and then they're spending it on taking care of their health, but then their family might not have as much of the money to use, and then that can affect their health and their ability to be productive at work. And so it's all very, it can spiral, right? So I think being able to focus on ways to be able to contribute to the community, and even empowering these people to pick their healthcare team. I think there are a lot of great providers out there that have that fundamental understanding of different socioeconomic incomes and the resources they have in working through those obstacles. So even just telling the patient they're their best advocate if they feel like a provider doesn't understand their lifestyle, to move on. It's totally okay to do. There's a lot of providers out there. Find someone that understands them and the challenges they face on a day-to-day basis.
Well, that was tremendously enlightening. A lot for everybody to chew on. No pun intended. Maybe a little pun. I'm going to move to you, Deb, to talk about stress. Stress is something everyone can relate to. Can you tell us, what is stress? Why do we care about stress? Is there a difference between home stress and work stress?
Thanks, Dr. Stern. I love the topic of stress because, we always think of it as something negative, but stress can be really motivating. Listening to Ashley speak, I think of all the nutritional, healthy meals that I want to make that I don't have all the things in my house for. And it can motivate me. I want to be healthy. I want to lose a little bit of weight. And you can get stressed over looking what's in your cabinet, especially when you recognize what shouldn't be there. So stress can be a motivator, but most of us think of stress as bad. And it's exciting that it's been recognized as, continued stress really can have a harmful effect on the body. So stress is a whole person response to a perceived threat. That threat can be a challenge. It can be a life change. Something that we see or hear that causes this whole fight or flight response in us. So stress isn't always bad. It's a defense mechanism. If someone's attacking you, you want your heart to pump faster. You want the adrenaline and cortisol to be surging. You want your whole body to respond so that you have that increased strength that you can run. But so much of the stress that happens to us may be something that we hear, something that we read, something that as we're driving in a car, we either hit a red light and that stresses us, or somebody cuts us off. So some stress can often seem like stupid stress, but yet it still has that physiologic response to the body. And the continued stress really takes a toll on the heart. And it's been seen in the last, I would say maybe 15 or 20 years as a real risk factor for heart disease and other chronic disease, as it can lead to inflammation. And working at the Katz Institute for Women's Health, where we're focused on women and their healthy living, we know that heart disease is a #1 killer of women. More women die from heart disease or stroke than all cancers combined, but only 1 in 5 women really believe that they have a risk, or that heart disease is a risk for them. And when we look at risk factors and see stress as one of them, it's something that we really want to address. So again, stress can be a physical or psychological response. You know, if you think you're stressed, you are, and that can manifest in so many different ways in different people, just as one thing will stress somebody else, but not the person next to them. So stress is a very individual response. I guess sort of to summarize, it's a whole person response, body, mind, and spirit. So to address it, we really want to have a whole person self-care plan. And whether it's stress at work, if you're a healthcare provider and you're stressed because you need to make the right decisions or somebody dies, or you're at home and you're making a whole meal and you forgot one of the key ingredients, and you start to feel that palpitation, or the shoulders up, or the pit in your stomach, or the pain in your back. Stress is very real and happens on this whole body, mind, spirit level. So I like to say that it's something we can all relate to. Some people have really great stress coping mechanisms, and others still want to work a little bit farther on it.
So what would you tell people to do to avoid or reduce stress when it's important to do so?
So I would say the first thing we want to do is we want to self-assess. We want to recognize when we're stressed. So for instance, as we're sitting here right now, I don't know how many of you have been sitting for a while, but let's just take your shoulders up to the ears, around and back, maybe like 3 times. And notice, have you been holding any tension in your body? Now that may not be related to stress, but it's a change in the body. We can reduce stress by changing the way we think. So there's a lot of different therapies out there to help people, recognize how they deal with stress, what they think about stress. Is it a stupid stress? Is it something you want to change? And how does it manifest in your body? And this is where lifestyle medicine really comes into play. As you mentioned, Dr. Stern, when you're looking at the different areas of lifestyle medicine, each of those areas can affect our stress. Ashley was talking about nutrition. If we eat nothing but simple sugars, that's going to stress the body. It causes a physical response, and it can lead to inflammation. If we're having challenges with relationships, that can cause stress. If we're not moving enough, we don't get the stress out of our body. So this whole person approach starts with you. What is it that causes stress, and how can you change it? If you're stressed by traffic and you don't have to be on the LIE during rush hour, don't go there. Some behaviors you can change and you'll decrease your stress. If you're stressed by the people you live with, that's a different story, unless you're looking to change your whole family. You don't change them, you change yourself and you change your response. And you look at it and you start to think, what are they saying that's stressing me? What's happening that's stressing me? So you do a little bit of self-reflection. Some people seek professional help, either behavioral psychologist, health and wellness coaching, you, Dr. Stern, lifestyle medicine, and change their behaviors, change the way they think to reduce the stress in their body. But it doesn't have to be going to a professional. You can certainly start to notice the breath. You can slow down a little bit. You can create periods of relaxation or joy in the day where we usually have our schedule of all the things we have to do. We can create time to do things that sort of fill our cup, fill our soul. Some people have great hobbies, social support. that you mentioned earlier is a big stress reliever. Laughing, music, many different activities we can do. Again, starting with ourselves. What is it that you enjoy? What is it that makes you feel relaxed? And what's real to incorporate into your self-care plan? How can you change your schedule? How can you change the way you think so that good enough is good? It doesn't have to be perfect. So, I mean, we could go on forever talking about how to reduce stress, but many different ways on that people incorporate without even thinking. So I guess I would say, take a more conscious effort, notice what's stressing you and develop some kind of plan so that you can deal with it and not let it get out of control.
It's almost overwhelming. There's so many things that you can actually do. Something that you're particularly involved with in your role at the Center for Wellness and Integrative Medicine is mindfulness. How do you see mindfulness helping with stress?
So mindfulness has gotten a lot of publicity over the last number of years, basically from the research Dr. John Kabat-Zinn has done with his mindfulness-based stress reduction course. So mindfulness is often seen as an antidote to stress, and it's paying attention to the present moment without judgment. So you notice your thoughts, you notice your feelings, and you become aware of them. So there's no wrong feeling. This isn't to say you can never get angry. You notice, I'm really angry. I get angry when I look at an email that says this, or I hear the news. You notice it, and then you sort of let go, and you notice the effect that it has on your body. So many mindful activities, being in the present moment, really help to reduce stress, and they help to induce relaxation. A simple, powerful, mindful technique is noticing the breath, which so many people have incorporated into their lifestyle. And it's something, this mindfulness, being aware, being in the present moment, is something that's been around in cultures for thousands of years. And you don't have to spend thousands of dollars learning all sorts of different techniques. You need to actually just do a practice. So I'd like to do just a simple 2-minute practice with us. And we're going to be mindful of our breathing and mindful of our touch. So what I'm going to ask you to do is just hold your thumb and hold it so lightly that you can almost feel the pulse in it. If you want to close your eyes to concentrate a little more, to be more mindful, you can do that. Otherwise, keep them open and take 3 breaths. Put your hands in your lap so you're comfortable. And as you breathe, notice the inhale, the pause, and the exhale and the pause. And then continue with 3 breaths while you're lightly holding the thumb. And then move on to the pointer finger and lightly hold that finger. Notice the temperature of the finger. Is it warm? Is it cool? Notice the connection of the right and left side of your body. And notice the breath. And allow yourself to sink into the rhythm of your breath while you continue and take 3 breaths, holding each finger on one hand and then on the other hand. Notice the inhale and the pause and the exhale and the pause. Nothing forced. Just an awareness of the inhale and the exhale. So you can now take a deeper inhale and a sigh as you exhale. And hopefully that 1 minute of focusing on the breath, being mindful of the touch, mindful of the temperature, mindful of the breath, helped to induce the relaxation response. Maybe took your heart rate down just a little bit lower, maybe decreased the blood pressure. We certainly needed less oxygen as we were slowing the breath. If you were having pain, a practice like this would help decrease pain. And it often can increase our energy, help the body be in an alpha brain state where you're aware, but you're relaxed, and help us to think before we make a decision. So one of the great benefits of mindfulness is the ability to respond instead of react, the ability to think clearer, the ability to be stable in the middle of chaos. So as you have all the stress going around you, before you get caught up in it, you can take a breath. You can be in the present moment. You can assess your situation. And then you can join in the chaos. But you're doing it from a choice as opposed to being pulled in. So many different mindful practices. I see the biggest benefit is that it can help you go from multitasking, which all New Yorkers need to do because we're constantly multitasking, to being mindful in the moment when there's an activity that we really need to focus on. So this is one of the many exercises that can help with stress. And you know, when we talk about exercise, everyone thinks about we need to run. And yes, running, walking, movement is great. It gets the stress out of your body. But mental exercises, you know, things like prayer, meditation, guided imagery, are all keyed into mindfulness, as is mindful movement. You know, when we talk about yoga, Tai Chi, Pilates, those are mindful movements. When we talk about yoga and Tai Chi in particular, they also include a portion of meditation. So it's often a focus on the breath sometime during the practice, and just lying or standing or sitting and being. So the more we can incorporate these practices into our daily practice, the easier it is to use the breath, to use the finger, to use a particular stance to help ourselves decrease our stress.
What about people who may have mobility issues? What can they do?
That's a great question. And we've really seen a shift in practices over the years because we look at the number of chronic diseases prevalent in our population. We look at the aging population, and where everyone was told to run, get on your Peloton and work really hard, we now see many activities geared towards people of all ages with mobility issues. So there's chair yoga, there's chair Tai Chi, there's even Tai Chi in the bed. Any type of movement is beneficial. There's a number, if you Google, you know, first, if you're going to start any activity and you do have mobility issues and you do have chronic diseases, you want to check with your provider. You want to be assessed maybe by a physical therapist so that you have a really great plan. But once you know your limitations, there's a wealth of information on our website at Katz Institute. Many people Google different 5, 10 minute, 15-minute videos. So people with mobility issues certainly can use all the mind-body practices. They can do the gentle movement, and they can really start to harness some of the power for self-care and for improvement. You know, people with arthritis would say, I don't want to move. It hurts when I move. But we know motion is lotion. So maybe if you're doing a slower movement, like a simple Tai Chi, just lifting the arms and bringing them down to where you are, that might be a start. And then as motion is lotion, you might even increase some of your mobility. So many ways to move when we're physically challenged. And I encourage people, you know, call the center, you know, check with your provider, but seek out programs because there are many programs for seniors and for others.
You know, you're an integrative holistic expert. What are integrative or holistic therapies? How do they help with stress? Are there specific treatments that help with stress that you recommend?
So many ways to deal with stress. You know, we can see providers to help us with the stress. Integrative therapies that help to relieve stress are numerous. They range from massage to reflexology, Reiki, which deals with energy work, acupuncture, lifestyle medicine. You know, integrative therapies means that we're integrating our traditional medical practices here in the United States with complementary therapies that are thousands of years old and another whole focus on self-care. So when we talk about integrative therapies, we recognize we need to do this for ourselves. No one can exercise for us. No one can meditate for us. No one can eat healthy foods for us. You know, it goes back to us. So a lot of these integrative therapies help people recognize what it feels like to be relaxed. After a massage, you know, I often said, oh, I never knew my shoulders went down because this felt so normal. So they help us to recognize the relaxation response. And then we can start to recognize when we're a little stressed. Integrative self-care practices, as we mentioned, imagery, meditation. Reflexology is meant as a self-care practice where you're doing reflexology on yourself, but it feels so much better when someone does it for you. Prayer, social groups, faith-based groups, the yoga we mentioned, Tai Chi, Pilates, and then all the home remedies to help with stress, whether it's a warm bath or a contemplative practice such as drawing or praying or journaling or fishing or gardening. I mean, the list goes on and on. It's what activity do you do during the day that you enjoy, that you can be mindful and put your focus on it. I mean, remember the Karate Kid, was like wax on, wax off, simple activities. So we don't have to pay, again, thousands of dollars. It's nice when we do these activities with the group and we get that group support. But I guess the takeaway is please take one thing from this and begin something so that you can, incorporate a little bit of mindfulness, some activity, some practice to decrease your stress. And if you need help recognizing it or further help, feel free to contact us.
Really amazing information on this extremely important aspect of lifestyle behaviors. So
that it's so empowering hearing you talk. I think that, you make everything feel very approachable when it comes to managing our stress. And so it's always so fascinating hearing all the different things we can do in our own home. And Dr. Stern, I'm really excited about learning more about sleep. I talk a lot about it with my patients, but I think it's a very underrated aspect of lifestyle medicine. So I first want to ask you, what is considered normal sleep?
Well, lifestyle medicine emphasizes the benefits of sleep as well as the consequences of sleep loss. So to understand the lifestyle medicine approach, it's really important to understand what normal sleep is. For optimal daytime alertness, average of 7 to 8 hours of sleep per 24-hour period is recommended for adults. Many people are familiar with the stages of sleep: rapid eye movement or REM sleep, and then there's 4 non-REM stages of increasing depth. We have something called the suprachiasmatic nucleus in the hypothalamus, and that helps control the circadian rhythms that keep sleep and wake cycles in order. And these rhythms are strongly influenced by exposure to light. So when circadian rhythms are disrupted, sleep will be disrupted, and that leads to insufficient quality and quantity of sleep. And by the way, in women, complaints of poor sleep, both quality and duration, have a prevalence of as much as 47%, which is almost half of women.
Wow. Yeah, I definitely believe that. I think that I've heard those patterns, and I've heard it from more complaints from females than males. So what's happening with our patients with their sleep?
Well, you already mentioned a few of these, and Dr. McElligott alluded to others, but lack of sleep is associated with many problems: immune system suppression, accidents, cognitive deficits, forgetfulness. You need deep sleep in order to consolidate memory. So people think they're in the beginning stages of dementia when they're really having forgetfulness that's related to not sleeping enough. Anger, relationship issues due to increased irritability, increased risk for cardiovascular disease. We know, and this was alluded to before, that elevated markers for inflammation are seen in those getting less than 6 hours of sleep a night, particularly in women. Also increased risk for diabetes, for obesity. If you are a diabetic and you don't get enough sleep, you're going to have trouble achieving good blood sugar control. There's a link between sleep and the hormones that regulate appetite. Ghrelin stimulates hunger. Leptin suppresses appetite. So if you have reduced sleep time, your leptin is decreased and your ghrelin is increased. So that means increased hunger and less appetite suppression.
Yeah. So as a lifestyle medicine physician, what is the process for assessing for sleep adequacy?
Well, we assess a given patient's situation by gathering first a complete history, sleep-related questions, typical work hours, symptoms associated with chronic insomnia, such as impaired daytime functioning, difficulty concentrating, errors, fatigue, issues with mood. Sometimes you hear symptoms of restless leg syndrome. We ask about daytime napping habits, medication use, alcohol, caffeine, eating habits. We often ask patients to keep a sleep diary. It's a very inexpensive way to track quality and quantity of sleep. And you get information both on sleep patterns and on what people do before they go to sleep. So in a sleep diary, people might note down the time they go to bed, the approximate number of times they awaken during the night, when they awoke, when they got out of bed, if they took daytime naps and how long they were. Some people talk a lot about wearing these devices, these wearable devices. They're convenient, but they actually tend to overestimate the minutes of sleep when compared to a formal sleep study. But those wearables, they can be used as a companion tool to getting a good sleep history and reviewing, a sleep diary if one is kept, but you shouldn't rely only on wearables.
That's so interesting. I didn't know that about the wearables.
Yeah.
You had mentioned sleep habits. So what is the lifestyle medicine approach for improving these sleep habits and sleep hygiene?
Well, most people's problem with sleep actually does relate to habits or hygiene. We come up with a personalized action plan for each person, and it focuses on their goals and their expectations for sleep. Overall, the plan is to improve sleep hygiene, sleep quality, and daytime functioning, while helping to improve any outcomes for the comorbid conditions that they may be suffering from. For one thing, it's essential to maintain regularity of sleep and wake times as much as possible. Small deviations are generally okay, but ideally, people should be going to sleep and getting up at virtually the same times every day, which many people would find incredible because they go to sleep at 9 o'clock, they go to sleep at 2 a.m., they go to sleep at midnight, and then they wonder why their sleep is a mess. Exposure to natural light is the key to getting the brain and the body moving. So it's really important to be exposed to natural light. I don't mean electric light, but the light of outside in daylight. When you wake up in the morning, you open the curtains and let the sun in because you want to set off that reaction of telling the brain time to get up. Being hydrated during the day actually helps ensure sleep at night. It also prevents people from awakening in the night from thirst. Many people wake up actually and they think they're hungry. They're actually thirsty, but they're perceiving it as hunger, and they get up and they eat something, which is really not helpful in order to then go back to sleep. Having enough physical activity every day. The recommendation, the American Heart Association and other groups, is 150 minutes per week outdoors when possible. Exercise during the day improves sleep during the night. It reduces the time it takes to fall asleep, and it increases sleep by as much as 42 minutes on average. We don't recommend that people exercise within 2 hours of going to bed because this can energize you right into insomnia, which is not what you want to do. A light dinner, not too late. Having a full stomach, I don't have to tell you, Ashley, interferes with sleep. People who have GERD and other reflux, they know they can't lay down after eating because they will have problems. But everybody, when you go to sleep with a full stomach, your brain isn't interested in sleeping. It's interested in digesting. It's telling the gut, digest. And you should not be eating a heavy dinner late. Alcohol late in the evening, caffeine from the afternoon on, all can interfere with sleep. Alcohol is particularly interesting because alcohol is a double-edged sword. First, it sedates you, and then it wakes you up later on. So alcohol is not is not recommended. Caffeine, why do people drink caffeinated beverages in the morning? Because it wakes them up. Well, if you drink caffeinated beverages at night, you'll wake up also. Electronic usage, that's really part of winding down in the hour before sleep. Electronics presents the problem of light in a certain nanogram length that stimulates receptors in the retina and that suprachiasmatic nucleus, and that disrupts circadian rhythms. And you can delay your sleep for as much as 3 hours. So the computer, the cell phone, the laptop, whatever it is that's electronic, can really harm your ability to go to sleep in a timely manner. And of course, if you don't sleep at night, you're often sleepy in the daytime, and then people nap, which is also problematic because that can upset the sleep cycle. If you need to nap, it should be no more than 20 minutes and always no later than the early afternoon. Because, if you sleep in the daytime, you're not going to want to sleep at night, and it becomes a real vicious cycle.
Yeah. And so with all of these things that you mentioned that can disrupt sleep, what are some good strategies for creating a sleep-friendly environment?
Well, in terms of the environment, keeping the bedroom cool helps signal the body that it's time to sleep. You'll always sleep better in the dark than in the light. Even street lights or a full moon can interfere with sleep. Some people say, oh, well, I need to go to the bathroom in the night. I need to have a light. Well, night lights are obviously important and should be used if you need to get to the bathroom safely at night, but they're usually located in a place where they're not going to disrupt you in terms of sleep. But darkness is important. I mean, think about bears. Bears don't hibernate on the beach. They hibernate in dark caves, and that's, it makes for better sleep. Cool and dark. Quiet is helpful. If you have a lot of outside noises and you can't do anything about them, you can mask them. Anything that produces a continuous low hum, like an air conditioner, a fan, or a white noise device, can mask outside noise. And then relaxation exercises, that's Deb's department: deep breathing, progressive muscle relaxation, body scanning, which involves a combination of mindfulness and meditation. They can all help lead people into a relaxed state before bedtime. This always makes people laugh, but I'm going to say it anyway. Wearing socks has been shown to help people sleep. The reason is not clear, but the researchers say it might have something to do with warming the feet and making the core temperatures drop, which promotes sleep. The socks, of course, should be non-binding, a natural material like cotton. So try socks if all else fails to help with sleep. You should ignore the clock. Everybody has a bedside clock, and nobody thinks about why they have a bedside clock. They ask them, oh, I need the alarm clock. Well, if you turn the clock face away from you so you don't see the digital light, the alarm is still going to go off. So ignoring the clock is important. So the light from the digital display doesn't interfere. And also people tend to keep looking at the clock. So you wake up at 2 a.m. and then you look again, oh, it's 2:20. Oh, it's 2:40. And this can go on for hours with people as they look at the clock. So both the light and the tendency of people to keep looking at the clock, if they awaken in the night, can keep people up. Other things that can help with the environment are like plants. If people like plants, there are certain plants that actually enhance sleep. Jasmine has been shown to elicit the molecular mechanism that's triggered by barbiturates. So it can soothe anxiety, it promotes sleep. Gardenia, the old prom flowers, has a sedative effect that may be as potent as Valium. Lavender has been shown to lead to a drop in cortisol levels, and that can also promote calmness. And those are just a few of the types of plants that can be helpful.
Wow. And I'm curious, from a nutrition standpoint, are there ever any foods that you recommend that can help promote sleep?
Yeah, there are foods that can help promote sleep. Carb-based meals, they increase blood levels of tryptophan, milk, warm or not. It's no myth in terms of promoting sleep as dairy foods in general. The key, of course, is to avoid high-fat dairy like ice cream, because that requires a long time to digest and it keeps the digestive system running, which can interfere with sleep. Foods that are high in tryptophan, oats, lentils, chickpeas, almonds, eggs, poultry. Everybody knows about turkey dinners and making people sleepy. Tart cherry juice contains melatonin, which may be helpful in promoting sleep. Of course, cherry juice, like a lot of fruit juices, have fairly high calorie counts, so that may be a barrier for some people.
Very interesting. I think that, hearing about just the stress and the sleep and how that all impacts our day to day, there's so much for us to take away. So this has been so enlightening for me, and I can't wait to even just apply this in my own practice.
And so thoughtful too, Dr. Stern, you made me think when we were talking about sleep and stress, the one thing that I didn't mention was, a lot of people can't sleep because they're stressed. And how do you shut the mind down before you go to sleep? And the whole area of gratitude, we often work with people and say, if you can't sleep at night, before you go to bed, make a list of 5 things you're grateful for. And they have to be different things each day. So sort of switching that mind from the worrying and all the to-dos the next day, bringing it back to that focus of, yes, I have a warm bed to crawl into, and sort of rehearsing your day, finding moments of gratitude or things that inspired you. So we can shift that mind into that relaxing mode out of that multitasking mode that so many of us live in. So
absolutely.
Yeah.
Absolutely.
Big connection between eating and sleeping.
There are people who do everything right and they still can't sleep. They're doing everything, all the suggestions, and lifestyle medicine in general supports the interdisciplinary team approach to care. So when people can't get sufficient amounts of sleep despite all the lifestyle interventions, they may be having symptoms that suggest disorders such as sleep apnea or narcolepsy, and then you need to refer to a sleep specialist. You mentioned briefly before CBT, cognitive behavioral therapy. Some patients may be candidates for CBT. That's an approved method for treatment of insomnia because it retrains the brain to relax and to wind down, and it can help break the cycle of sleeplessness in patients. So there are so many things, that people can do if they've tried everything and it's still not working.
Yeah, and so many advances. I love that the whole concept of we can teach an old dog new tricks. Just because you had trouble sleeping since you were a kid doesn't mean you can't change something around, or because you never could lose weight before. There are ways to self-assess and lots of data to show that we can create new pathways in our brain and get rid of some of those old habits that really, challenged us in terms of lifestyle.
So having listened to all this today, what do each of you feel is the most important takeaway for people who are listening to us? If they had to take one thing away, Ashley, what?
Yeah, I think, we've covered so much, so many different things that all actually fall into one big category of being lifestyle medicine, right? So I think the biggest takeaway is that there's always something someone can do, right? There is always something that someone can do, whether it's in their own home or with the help of a professional, to help improve their health. And that is really all we ask for, is just start making small baby steps. We talk a lot about short-term goals and long-term goals. There are always short-term goals we can make that we can progress on. And so that's just the place to start, is with a small short-term goal.
Thank you. Deb.
I love that, Ashley, because that goes along with our whole area of the health and wellness coaching, and you make one small change in one area and it's going to affect everything else. If you start to sleep better, that's going to affect how you move, the choices you make in the foods, the choices in your relationships. So while Dr. Stern highlights 6 areas of lifestyle medicine, start small, but please don't leave here today without setting one short-term goal. one behavior, not a wish, not something you want, but it'd be something you're going to do. You know, whether it's you start to investigate meditation, or you start to really look at the labels of your food, or plan a healthy meal for tonight, you know, or start your diary, your food diary, your sleep diary. I usually say, if you're going to do a journal for 1 week, write down everything so you can see the correlations between what you're eating, how you're sleeping, how you're moving, how you're feeling, how you're moving your bowels, what you're drinking. So yeah, please start. I guess that would be my takeaway is, you know, it's a full-time job to take care of yourself. So
Yeah.
let's start with one area, since we don't have 24 hours to take care of ourselves.
Just to add to that, you know, when we are making short-term, that's a whole training in itself, is making these goals, right? So, you know, I often have people backtrack a little bit on what they make their goals, you know, saying, don't be overly ambitious. So, you know, how many days a week do you want to do that? And for how many minutes? You know, being as specific as possible can help them really feel like they're accomplishing something, and also empowering them to build upon that.
If there's one thing I can say about sleep, is that, you know, sleep is not optional. Sleep is like time. You've lost it, you can't get it back. You can't make up for lost sleep. So please don't take sleep for granted, and don't view it the way, you know, Puritans tend to look at sleep as slothful waste of time. It's really not. It's essential to good health. So that's what I would say about sleep. So thank you both for this amazing conversation. You've been wonderful. And thank you to our audience for being with us today. We wish you lots of good health and well-being.